Joining us, I'll tell you, we had a tough time finding a Democrat who wasn't busy today, but we are and the one that was going to join us couldn't be with us at the last minute here, but we're grateful to Mike Pence of Indiana, who chairs the Republican conference, to be with us today. Congressman, it's always good to see you, sir. Thank you for joining us.
Hi, folks. Glad to be here.
You have said in other interviews that you feel that the bill in its current form right now would actually cost cause many Americans to lose their health care coverage. How would that work?
Right. Well, it's and let me say, House Republicans support market-based reforms to lower the cost of health insurance and health care for all Americans. But this bill, we believe, would set us in the direction of a government takeover with about nearly $1 trillion in taxes.
How would we get to government takeover?
But the way you get to a government takeover is this. I mean, once Uncle Sam opens the doors at a government-run insurance plan that's available for every American, in the worst recession in the last 25 years, there's not a business in Indiana, not a business in this country that isn't going to look at their employees and say, you know, I love you, but I think we're going to have to discontinue our health insurance here and send you down the road to the Uncle Sam program.
Okay, so but that was what I was getting at. They would, if in fact a company does decide to do that and they take their employee off of their health care rolls, the government is there to pick that up. And isn't that the whole point of what we're talking about with this health care reform package?
Well, no, I don't think the point here is to drive over 100 million Americans out of the health insurance program that they have. You know, most Americans that have health insurance through their employer are pretty satisfied with it. But independent analysis by the Lewin Group suggests that, you know, more than 100 million Americans could lose the health insurance they have through their employer if the administration and House Democrats get their wish and launch this new massive government-run health insurance option. You know, we ought to create more options.
The Blue Dogs came out and said they have concerns about that public option as well. Their compromise was to say, we're going to do a bunch of private, nonprofit cooperatives, a la, you know, Blue Shield, the way Blue Shield used to be. Does that not satisfy you? Does that still concern you?
Well, in the Senate, they're talking about the co-ops. In the House, all they did here was do a little bit of trimming around the government-run plan. I mean, the bill they're going to report from the Energy and Commerce Committee, they supposedly came up with $100 billion in savings. They exempted a few business, but it's still a government-run insurance option. But the co-ops they're talking about in the Senate, I think, you know, as a construct are intriguing, but I think Senator Harry Reid put it well when he said, we're going to have a government option, call it a co-op, call it whatever you want, we're going to have a government option. You know, if it turns into, as the Wall Street Journal today says, you know, if we're launching a co-op essentially as a Fannie Med, then I think the American people aren't going to be too enthusiastic about
so that's
government involvement in that kind of program.
A lot of people today were saying that the co-op concept might be considered the common ground. You disagree with that?
Yeah, I do. You know what I think the common ground really is, what's been common ground in the past, and that is vastly expanding health savings accounts for small businesses to be able to utilize those high deductible insurance plans and put a little bit into a fund for their employees for first dollar benefits. And then the other thing is, you know, what a true co-op would be is the kind of co-op we have for federal employees and members of Congress, and that is allow associations like association health plans to be formed across state lines, across the country, allow consumer groups to purchase insurance on a national basis. They're talking about exempting these co-ops from state regulation. Well, why don't we just exempt associations right now without a government involvement from those state regulations so that you can create these new products, not a government-run insurance plan, not a government-subsidized Fannie Med type plan, but really and truly allow new insurance products to emerge on the scene.
Congressman, we wish we had more time, but again, we're grateful for your time. Thank you for joining us today, sir.
Thank you.
Congressman Mike Pence of the Republican of Indiana joining us today.